Good morning. We're just doing a check. So,
Recording in progress.
okay. So Matthew, can you hear us? And Jake, can you hear us?
I can hear you well, Sam. Thank you very much.
Great. Thank you. And good morning, Johanna. Are you?
I'm here. Does my audio sound okay? I'm trying a different device today.
Okay. Yeah, we can hear you just fine. And
Okay.
I'm just checking.
I'll start Live Manager.
Okay. Let me go there. Make sure. Okay, thank you, Johanna. It does show it's in progress. That's great. Okay, I will mute everything until 8:59.
Check, check. Hello, hello.
Check 1 2 1 2 check. There we go. Okay, Chair Sabatier, I think we are ready to go. Let's see, I'd like Chair Simon, can we check your microphone?
Yes. Can you hear me?
Yes, great. Okay, terrific. And okay, we are ready to go when you are.
Okay. All right, let's go ahead and get started. It is 9 a.m. in the morning. It is November 16th, 2021. This is a regular meeting of the Board of Supervisors for Lake County. Let's go ahead and start this with a moment of silence, and I believe that Supervisor Simon has a moment of silence.
Yes, Chair. Thank you, Supervisor Sabatier. I do have a moment of silence today for Joanna Rose McCabe, who passed on November 5th. Her parents are Matt and Aaron McCabe. I just want to put out some love and prayers at this tough time for them. So today's moment of silence is for Joanna Rose McCabe.
And we also have one from Supervisor Pyska.
The Smith family lost their home last weekend in a house fire in the Kelseyville Riviera.
Supervisor Pyska, would you please lead us in the Pledge of Allegiance?
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Let's go ahead and go down on the agenda. Item number 4, consideration of extra items not appearing on the posted agenda. Any added items? Looking at our supervisors and seeing nothing, let's go ahead and move on to approval of the consent agenda. Are there any items that Board of Supervisors wish to pull from the consent agenda? And so we do have 3 on the list for clarification and discussion today, 5.5, 5.6, and 5.15. Anything else that I may have missed?
Yes, Mr. Chair, we'd like to pull 5.2 as well and bring it back on a future date rather than take it up today. It needed a correction.
Okay. Thank you for that. I know you did speak to me about that yesterday, and I forgot. So thank you. And if there's nothing further, let's go ahead and open it up to the public and see if there's anyone from the public that wishes to pull an item from the consent agenda for further discussion. I see none in the boardroom, and I see none in the Zoom room. So let's go ahead and come back to the board for approval of the rest.
Mr. Chair, I move to approve the consent agenda 5.1 through 5.3.
We are skipping 5.2.
Okay. Then I wrote it down wrong. Okay. So I move to approve 5.1, 5.3. So, and then we're skipping
And then
5 and
5.4.
6. So 5.7 through 5.14, and then 5.16 through 5.18.
And if we can add 5.4, then we're good.
And I'm adding 5.4.
Second.
Okay, we have a motion from Supervisor Scott, a second by Supervisor Simon. Johanna, good morning. Roll call, please.
Good morning. Supervisor Simon?
Yes.
Supervisor Crandall? Supervisor Scott?
Aye.
Supervisor Pyska?
Yes.
And Supervisor Sabatier?
Aye.
Thank you.
Mr. Chair, we seem to have a bit of an echo with the microphones. If we could ask Sam to advise, I'm hearing an echo when you speak in particular. Is there an echo when I speak?
I am pretty loud, so that could be the problem.
It-
I didn't hear it as I was talking,
are you hearing
a little
an echo,
bit.
Anita? Does someone have a mobile device with the volume on?
No, it would be a really bad echo if there was anything on for Zoom. Then you get that sci-fi noise. Maybe if you could just lower my mic a little bit. Let's see if that helps. Maybe. I could have just lowered my voice too, but
Still hearing the
for
echo.
some reason that didn't seem to be the option.
And then we also want to make sure our participants are wearing their masks in a compliant manner.
Please make sure to wear your mask. In the courthouse, we do have a mandate to please all wear masks. So if you could please cover your face, that would be great.
Mouth and nose.
Thank you. And then let's go ahead and move on. It is 9:00. Let's go ahead and go 9:05 a.m. item, public input. Anything not on our agenda, if you wish to express yourselves to the board, you have 3 minutes. Again, anything that is not on our listed agenda items, 3 minutes, please come up to the microphone. And the microphone will amplify your voice. You don't need to lower your mask for speaking.
Well, I can hardly understand what you are saying, so...
Really, I'm amplified. We just have to
Yeah.
lower the volume.
So I cannot even talk to the microphone without mask on?
At this moment in time, until changed, there is a rule in this courthouse to please wear a mask. Everybody is doing
I'm
it.
wearing it and I'm putting it on my lips. Is that sufficient? Yeah? Well, I'll try my best.
If you
Okay,
could,
that's what
if
I
you could
came
make
in-
it quick.
Excuse me?
If you could please make it quick. Let's go.
Well, I can make it as quick as 3 minutes. Yeah, I'm just suggesting that the whole thing with the COVID-19 and this whole charade be revisited by this board and all people who are affected by it.
Good morning, board. Um, I'd like to use this opportunity to share some dire timelines that the local cannabis community is up against at the state level and to make sure that you, county leadership, is aware of what we're facing. This is a follow-up to a letter that I sent each of you and the Director of Community Development. Really, this is important, and I think I'd like to use this 3 minutes to explain it further. In the governor's trailer bill, the state greatly compressed the timeline for provisional licensing, which has applicants racing time to ensure that they are eligible for state licenses. Meanwhile, many of them are paused in the county's queue. We're approaching two critical deadlines, which we refer to as cliffs, that will affect all cannabis cultivators in California. The first is that applicants with an outdoor cultivation area of more than 1 acre or 22,000 square feet of mixed light must apply by December 31st, 2021 for state provisionals. That's 6 weeks away. New provisionals will not be issued after June 30th, 2022 for general applicants with an outdoor cultivation area of less than 1 acre. This is something the county can do to help ensure that eligible projects meet these deadlines. Other counties have created a letter of conditional authorization, which simply indicates a project meets the local land use parameters and is eligible for consideration only for a state license. This letter does not secure local or state licensing. It only allows the applicant to secure a place in line with the state. If the county wants to continue to grow and have a sustainable cannabis industry, this letter is paramount to people getting their place in line with the state. If the county does not issue these, then we can bet that the local cannabis industry will stay as it is. There will be no growth for probably 18 months to 2 years. I just want to bring this to your attention so that hopefully we can find a solution and move forward with a sustainable industry in this county. Thanks.
Thank you very much. I'm going to pause public comment for a second. Is that TV sound on? I'm getting some feedback.
Mr. Chair, we're also having some trouble with sound in Zoom and on Facebook as well. So,
Supervisor Crandall, how is the sound going for you on Zoom?
Yeah, I could hear where I'm at, but I'm getting other text that it's not. On Zoom, oh, not Zoom, I'm sorry, Granicus, YouTube, and Facebook, but apparently it's working now.
Okay. And I don't know if it was the TV, but it was coming from that.
No, I'm hearing it.
Sounded like the TV.
Something from over there.
Keep going. Keep talking. Oh. This is the echo. Right now.
Check, check. Hello, hello. All right. Hopefully that resolves it for all parties. No, you still hear an echo? Just yank the cord.
Too many things.
Hello, hello.
Again.
Are we still hearing an echo?
Somebody's got there's a device on. That's the echo that you're hearing. This is on. Sorry.
Yeah, it's kind of running.
Oh, let's, yeah, there it is.
Go ahead, do it.
Hello, check, check. Trying to find the echo. I apologize for the inconvenience and the technical difficulties. Many different speakers, many different microphones, and many different platforms that we're being streamed on. Sometimes complicates things. Is there anybody in the audience that might have Granicus or Zoom on at the same time? Doesn't sound like the mic is on, but it sounds like the speaker might be on. Says your microphone is not working.
Yeah, microphone's off, it says.
But it's coming through the speaker.
You just got to turn off the audio.
Hey, this is Jake. That that projector, that should not be in audio at all. Just leave audio on that.
Yeah, leave computer audio.
I can't see it.
Yeah, so click the X. Click the arrow next to the microphone.
Is that it?
Yeah. And then go up to the second one more up. No, right there.
Oh, thank you, I can't read it.
All right, hopefully that solved the problem, and we will not hear any more echoes.
Mr. Chair, before we move on from this problem, I'd like to try to solve another problem while we're
Okay.
paused. So I'm hearing that we may not have sound in Facebook and on YouTube. Supervisor Crandall, is that the word you are getting? Okay.
It's good now. It's good now.
It's good now.
It's good.
And sound in Granicus. Do we know if sound is projecting in Granicus?
It should be.
I'm going to assume it's good because nobody's telling me it's not. So
Yeah, I
thank
think
you,
it's
Mr. Chair.
All right.
We got sound and granite.
All right. Thank you.
All right. Again, apologize for the pause. Just want to make sure everybody's able to participate. We have another hand up for public comment. Damian Ramirez. If we can please unmute.
Good morning, everyone. Damian Ramirez here from Lake County Grown. I wanted to briefly bring to the board's attention the tax challenges that many operators have faced this year in the cannabis industry. 2021 has brought these issues to light for many cultivators through the severe drought, also accompanied with probably equally as a severe drop in the market price for product. The drought created circumstances where many growers were unable to cultivate their entire permitted canopy space this year. This left operators basically scrambling to change their taxable cultivation areas, sometimes past the time frames in which to do so. I think that definitely created a further burden on the CDD staff, which we all know is already running on all cylinders, really, to keep up with their intense workloads they already have. So it's clearly not good for any of the parties involved from that perspective. Furthermore, this steep drop in this pricing this year has affected profit margins greatly for many operators, and unfortunately, many operators will struggle to even make it to next year. It seems like all these projects that will undoubtedly fail. This will, of course, create a loss of revenue for the county. Obviously, not to mention the burdens that the individuals themselves or their entities must endure. The tax burden plays a large role in all of this. This is, of course, the nature of business, and I'm not by any means trying to give anyone a free pass. I'm a business person myself. I fully understand that perspective. However, I think that the challenges presented in this year's growing season provides us with an opportunity really to potentially revisit our cannabis tax structure. I believe there is ways to better structure the taxing of the cannabis cultivators. I encourage the board to take a look at other counties, how they tax operators. It just might be time to switch from taxes based on total cultivation area, the total space, to taxes based on potentially gross receipts. A lot of counties do a percentage of gross receipts. Maybe there's even a hybrid type of method that could benefit all parties involved. Minimums going to the county so they can make sure they're getting a certain cash flow in regardless, and then the cultivator, if they have a challenging season, they won't drown in a tax burden that might be not equivalent to what they actually produce. So I just think it's a good topic to discuss at a future meeting. So thank you all for your time, and as always, thanks. Bye.
Perfect timing on your 3 minutes. Thank you very much for your comment. And the last hand that I see is from our Department of Water Resources, Marina Delagianis. And I believe you wanted to share your screen. Hopefully
Yes.
you have the ability to do so.
That is correct. I'm gonna do that. Can everyone see my screen okay?
Yep, there it is.
Awesome. Thank you so much, Mr. Chair. Good morning, everyone. My name is Marina Delagianis. I serve as the Deputy Water Resources Director of the Lake County Water Resources Department. I also serve as the lead for our Big Valley Groundwater Sustainability Plan Advisory Committee. I am here to share with the community some exciting news. We have our draft Big Valley Groundwater Sustainability Plan, GSP, is out for its formal 21-day public review period from November 12th through December 3rd, 2021. Here on the screen, you can see our Big Valley GSP, the draft form of it. All of the documents and related material are here. You can click on it. We also have the instructions on how you can submit these public comments. So you can submit these public comments one of 3 ways. Again, these have to be submitted by December 3rd, 2021. You can send these comments to us via email at water.resources@lakecountyca.gov. You can drop them off if you visit us here on the 3rd floor of the Lake County Courthouse. Or you can mail them in to us again at the Lake County Courthouse. So here you can see all the instructions and how you can get to these documents. If you need assistance, please feel free to give us a call at 707-263-2344. Send us an email at water.resources@lakecountyca.gov. Or again, please come visit us on the 3rd floor, and we're more than happy to help you get these materials and how you can get to these materials. I'd also like to point out that if folks want to get caught up on all of the previous public meetings that we have had, you can go to the Programs and Projects, Big Valley GSP, and Advisory Committee documents here. And then you can see all previous public meeting agendas, minutes, videos, and slides. Or if you want to get automatic emails, updates, reminders, you can stay connected via the Stay Connected page where you sign your name, email address, city, phone number, and in and out in Basin. And that's when you will get routine emails and reminders of our upcoming public meetings and anything related to Big Valley groundwater. We also have 2 public meetings taking place this week. The first one is an open house and information sharing session, which is taking place this Thursday, November 18th from 5:30 p.m. to 7 p.m. And then our monthly GSP Advisory Committee meeting, which is taking place this Friday, November 19th from 11 a.m. to 1:30 p.m. Both these meetings have the options of joining us in person with COVID protocols in place, of course, or via Zoom. So if you have any questions, need additional information, again, feel free to give us a call at 707-263-2344. Visit us on the 3rd floor of the county courthouse, or send us an email at water.resources@lakecountyca.gov. And that is all I have. Thank you.
Thank you very much for that information and your comment. And that does it for public comment. So next, we will move on to our 9:06 a.m. item. And just to state that the items that were pulled from the consent agenda, we will try and see if we can fit it in. We have a large item at 10:15. I don't think that we're going to be able to fit it in before then. So my guess is that it probably will not be until the afternoon. We will make sure and get to those department heads and let them know ahead of time, maybe 5 or 10 minutes ahead of time, to see if we can let them know where we're at. So next we're going to start with our 6.2, our 9:06 a.m. item, consideration of update on COVID-19. And today with us we have Dr. Charlie Evans. Welcome. Oh, and you're muted.
Is that better?
Yes.
Great. Thank you very much, Mr. Chair, for inviting me back to speak to you about COVID-19. Sarah Maricos prepared a very nice epidemiology report, which I think we'll start with that. So if we can put those slides up.
And hopefully somebody is able to do that, because I do not have those slides.
I think that
Johanna has the slides, and Matthew, both. Johanna or Matthew, are you able to put them up?
Yeah, let me find them really quick, sorry.
While she's getting those up, I can go ahead and speak to what they're going to show us. You know, in general, what we're seeing with COVID-19 in the state is a very, very gradual decline, but we're kind of reaching a shoulder or a plateau in that decline. So cases throughout the state are still declining somewhat. And it looks like, here we go. So go ahead and go to the second slide. So here you can see within the state, we're at 12.2 new cases per 100,000. Average daily deaths is down to 49 per day. It's still very high, but much better than it's been. And the test positivity is down to 2.4%. Go ahead, next slide. So I wanted to speak about vaccination coverage in Lake County. So these numbers reflect a change in the way we're calculating them because we added all the eligible 5 to 11-year-olds. So it added 5,300 people to the denominator. So you might see that our percent vaccinated dropped because the denominator is bigger. So we're at 58% fully vaccinated, 7% partially vaccinated, and 35% unvaccinated. Next slide. So this is testing and positivity in Lake County. And this is encouraging news that our test positivity has dropped 2.8% from the last time we reported. So we're at 4.4%. We're well above where the state is, but we're continuing to see a decline, which is, in my opinion, very, very positive information. Next slide. So this is just showing that the two big surges that we've had, and we're down to 41 cases average per day. This is still way higher than we were at our nadir back in June when we were down about 7 to 10 cases per day. Next slide. So of those cases that we have, the majority are unvaccinated, 333 or 74%, and about a quarter were fully vaccinated. So again, we're seeing some breakthrough infections that is a significant number, and I'll talk about that. And 10% were partially vaccinated. And next slide. So these lines, we're the green line on here. And if you look, you see that the green line has been coming down gradually since the middle of September, and it continues to go down. The blue line is the state line, and it's fairly flat. The red line is Mendocino County, and it is creeping up, which is a concern to me to have a neighboring county with a rising infection rate, because that can very easily spill over into Lake County. Okay, next slide. And this is the vaccination status for those that were hospitalized. And again, the majority of the cases being hospitalized are unvaccinated, 79%. But this is less than what we saw even a month ago, where it was more up in the 90% range. So again, I think this represents some of the breakthrough infections we're seeing with the vaccine and the waning immunity of the vaccine, which I'll talk about. And the vaccination status of the deaths. One of the deaths was vaccinated, 8 were not. So we had 9 cases from September into September through October. And next slide. Well, I think that's the last slide, actually. So while you're there, if you could also put up the slide that shows where you can get tested and where you can get vaccinated. I wanted to make sure that information was out there for everybody. There's quite a few vaccination sites and quite a few test sites. And for those that have internet, there's a link that can take you to those. If you don't have internet, there's a phone number that can take you to those. So here are the links for the testing and for the vaccination sites, and then a phone number for where you can call if you don't have internet services. Okay, so with that, I just wanted to go on to my general comments. We've seen an overall decline in the numbers in the past couple of months, and I'm really pleased to see on Sarah's report that it shows a continuing decline in Lake County. In other parts of the state, we're not seeing that decline. We're seeing a plateau, or we're seeing a leveling or even a rise in numbers. And that's being reported nationally now as well. So I think this is just a real warning to all of us that we could have a winter surge, and we need to be very, very cognizant of this and apply all the public health measures we've learned throughout this pandemic. California is showing the same pattern of decline and plateauing that India showed after their Delta surge last spring. The plateau did not come down to the same baseline level in our state that it had been in the spring or early summer of last year. And what we're seeing in different parts of the country, the United States now, is we're seeing surges in areas that, generally speaking, are less vaccinated than other areas. We still don't understand a lot about this virus. We certainly don't understand why it surges and then for no reason retreats, and then why it surges again. But we've been through enough surges to know that it's very capable of doing that. We might think that we're at a vaccination rate where that won't happen, but that's not the experience that we're seeing nationally or internationally. So a great example is the Netherlands. They were up at 68%, and they completely opened up and declared that they were through with the pandemic, only to go into a big surge and having to close down when all of their facilities were overrun with infections. So I think that could very easily happen in Lake County as well, if we're not very careful with the public health measures, particularly vaccination, but also masking, careful hand washing, good nutrition, social distancing, all the things that we've been talking about throughout the pandemic. When we first started talking about this virus, we also talked about a immunity called herd immunity, and we suggested that if we got to a point where 80% of the population was either infected or immunized, that we might develop herd immunity. Now, there's so many unknowns with this virus, and many of which we continue to learn on a daily basis. One of which we've learned is that the vaccine does not have the long-lasting immunity that we might have hoped it had. We've also learned that the virus can mutate and create variants. The Delta variant is a monster. This variant is highly infective, and it requires a much higher level of immunity within a community to quell ongoing infections. So that all has impact on whether you reach herd immunity. With the waning of immunity from vaccinations, I think it's not likely that we're going to see herd immunity in our community for some time. And my personal feeling is that the Delta virus is infectious enough that if you're in public with a level of infection we have, you will get COVID if you're not vaccinated. Herd immunity is not going to help you in that regard. I wanted to talk about the waning immunity. As you've all read, we've seen that boosters have been recommended. When the vaccine first came out, we boasted a very high effectiveness rate. Initial studies were upwards of 90% effective, which is unheard of for a vaccine. This is a superb vaccine. And what we're seeing now is that over time, starting at about 2 or 3 months, you see a drop off in that immunity, bringing the effectiveness rate down into the 70s or maybe even the high 60s in some people. So don't get me wrong, I'm not saying this isn't a great vaccine, and I'm not discouraging people from getting vaccinated. This is a superb vaccine, but it's not a perfect vaccine. And as we learn more and more about it, we learn how to use it better. And that's why these recommendations about boosters have come out. It's fortunate that even though these vaccines do not protect people from infection as the immunity wanes, we have seen that they do protect them from severe illness and from death. And so it's a huge benefit that we get from these vaccines. But I want to be clear that the vaccine is a great vaccine. It's not a perfect vaccine. And we need to modify the way we use it, which is why the boosters have come out. The other factor on this is that those that are getting sick from this vaccine, who are vaccinated, are oftentimes those that have comorbidities. They're respiratory illnesses, they have cardiac illnesses, they're immunosuppressed for whatever reason. These are the people who it's really important for them to get boosters, and it's really important for them to continue to heed the public health measures of masking, social distancing. So I wanted to talk about the boosters. So the CDC recommended boosters for specific age groups almost a month ago, particularly to the vulnerable populations. Last week, CDPH came out and recommended boosters in the state of California to all those who thought they would benefit from the vaccine. The caveat was that you should wait 6 months after the Pfizer vaccine and 6 months after the Moderna vaccine, 2 months after the Johnson & Johnson vaccine. They also said that you can mix and match the vaccines. And their message here really is that what's important is that you get a boost. It doesn't matter if you had Pfizer, you can get a Moderna boost, or if you had Johnson & Johnson, you could also get a Moderna or a Pfizer boost. What's important is that you get a boost. And I think what most public health officials are recommending is if you can get the vaccine that you had initially, that's the vaccine you should go for. If you can't, just get a boost. Another question that's come up that I've been asked a lot is, well, does this mean that in another 6 months we're going to need another boost? And the answer to that question is we really don't know. So much is unknown on this virus, and our growth of knowledge is expanding exponentially weekly. We may need another vaccine in 6 months. It will depend on the variants. It will depend on our development of successful treatments, and it will depend on your baseline health status and what the level of infection is in our communities. So we'll have to wait to see the answer to that question 6 months from now. Holidays are coming up, and I wanted to talk about the holidays because everyone's planning on gathering. And this is when we started our surge big time last year with holiday gatherings. They were a big spreader event. And so ways that you can safely gather and prevent infection. If you travel on holidays, you should get tested before you travel, and you should get tested after you travel. Antigen tests now are readily available in drugstores. There's testing available throughout the county at testing sites. If you get an antigen test, it should be done 24 hours before you travel, and a PCR test 72 hours so that the result is back before you get to your destination. If you have unvaccinated members coming to your holiday gatherings, you should take extra precautions, and those might include masking and effective masking. Masking with care such that you have a good seal, preferably with an N95 or a KN95. You might consider gathering outdoors, enforce social distancing. You can increase ventilation if you're going to be indoors, or you can curtail the time that you're going to be indoors. All of these will contribute to less transmission of the virus. If you're hosting a gathering, you might consider instituting and requiring these simple measures to help save lives of your loved ones. We wish all to move back to that level of normalcy that we miss so much. And I think if you are fully vaccinated, you can have holiday parties with your friends and return to a very normal lifestyle. So if everybody at your gathering is fully vaccinated, I think you can enjoy yourselves. Particularly if you're doing testing before and after the gathering. I feel it is still very risky to have gatherings with unvaccinated people if they're not masks. Until such time our baseline of infection returns to where it was last spring, this is going to be difficult, and if we're not cautious about taking these precautions, I can see that we could promote another surge of the virus. New recommendations on vaccinations included children aged 5 to 11. There's 73 million children in our country. Already, we've had 5 million infections in children. 700 children have died. That means less than 1 in 100 children have, 1 in 100,000 children have died. But if you were infected, 1 in 7,000 died. As in adults, children are less likely to be hospitalized or become critically ill if they are vaccinated, and such, it's a strong recommendation. But probably more importantly, children are also the reservoir or source of spreading COVID to their parents and to their grandparents. And these are the people who are, generally speaking, more vulnerable to the infection. So our success at vaccinating this younger group of children will go a long way to keeping them safe, keeping our schools open, and curbing the transmission of the virus in the community. I wanted to talk about variants. Currently, the Delta variant remains the dominant variant. The CDPH has done sequencing of the viruses. In July, they sequenced 22% of the infections, and in August, they sequenced 15% of the infections. They're monitoring 9 different variants. The Delta variant is still the major player in California and throughout the country. 98% of the infections in October were from the Delta variant. And they do not feel that any of the other variants are currently listed as a variant of concern. So we're still worried about the Delta variant. Some of you may have heard about new treatments that are out there. Merck has licensed a drug in Europe and that they're using in Europe. Initial data suggests that the treatment is quite effective at reducing severity of illness and reducing mortality. It's not yet licensed in the United States. There's multiple other drugs that are being put forth for testing. And I think it's likely that in the spring, some of these will be licensed and will definitely have an impact on the pandemic. So in summary, I'm cautiously optimistic about the level of infection in Lake County and the direction we're going in the pandemic. I'm very happy to see the decline of test positivity and decline in the number of infections. But we still have a huge opportunity on the vaccination front. And I encourage you all to talk openly about this, to share your information from reliable resources, and to talk to your family members and loved ones who aren't vaccinated. There's a huge community effort needed to stop this virus, but I'm confident that working together, we can all make a huge difference. And I want to thank you, Mr. Chairman, for inviting me back. And I wish you all safe and healthy holidays, and happy to answer any questions that you might have.
Thank you very much, Dr. Evans. We do have some comments and questions. Let's go ahead and start with Supervisor Paiska.
Thank you for coming, Dr. Evans. It's really wonderful to see you again. I'm wondering when Lake County is going to receive the pediatric doses for the 5 to 11-year-olds.
Now, I'm going to defer to you, Carol, on that. Do you know?
I don't know if our director of nursing is in the room or not, but the last I communicated with her, we were still awaiting receipt of the pediatric doses here in Lake County. Is Eileen in the room?
Yes, she is.
Hi, I'm here. Thank you.
Thank you, Eileen.
Yes, just to give an update, as Dr. Evans mentioned, from our public health website, or the phone number where you can call us to get the vaccine information. On our site, we keep that updated. We're reaching out to folks that are listed on the website almost daily to make sure that we are keeping our sources up to date. And so right now, Adventist Health is showing that they have vaccine for 5 and up, as is Walmart at both their Clear Lake locations. And we are waiting for more. I know Safeway is hoping that early next week they'll be able to start here in Lakeport. And so, again, this is a great resource to look at our website, and we're continuing to update it. It shows right now everyone with the 12 and older, and we are adding the 5 to 11s as they come in.
Thank you. One of the other questions And I don't know if this is a better question for Sarah, and she's unfortunately not here today, but I'm wondering what would be the best indicators to gauge the spread in our community if we have so many people taking at-home tests and not reporting? I don't have any idea what that percentage is, but I know that that option is available to so many people and they're choosing to take it, and that's one of the resources that we have now, but it does impact the data that we're able to gauge our response by. So I don't know if you have any thoughts on that, Dr. Evans?
Yeah, that's an excellent question. And, I think it's a very positive thing that these antigen tests are becoming more available, because the more testing we do, the more detection we have, and the more likely we can be responsible about quarantining when we're infectious. It does pose a problem to the data in terms of the total numbers, but the data can also, it's not going to change the hospitalization data and the death data. So what we're really worried about is not the total number of cases. It's really, we're worried about the people who are sick enough to be hospitalized, and certainly those who require ICU care. So we're going to follow that as a bellwether sign of how our infection is going. So yes, there might be more cases of infection out there that we're missing, but we're not going to be missing the hospitalizations. And I think that's a much more critical value to follow.
Yeah. And do you have an idea on how our hospitals are being impacted currently?
So the numbers are drifting down in Lake County. They're drifting up in Mendocino County and Sonoma County. They're also drifting down. And, usually when you see an uptick in the number of cases, you don't see the hospitalizations until a couple of weeks later. And so, for example, you look over at Mendocino County and see the numbers going up. We can expect to see their hospitalizations to continue to go up as well. You see our numbers going down. If indeed the numbers truly reflect what's there, then we should expect our hospitalization numbers to stay down.
Thank you.
Thank you. Any other comments? So I did have some questions and comments. One is, I saw something that I'm going to ask for a clarification. I don't think that you can provide that clarification, but in the PowerPoint presentation, it showed a total of 9 deaths in September and 2 in October. And when I look at our main webpage, it shows 19 for September. And so I'm hoping that you can come back and provide a clarification on what that number exactly is, since there seemed to be a discrepancy between what's put on our website for those time frames and what was provided here. And not sure what that will do to the numbers overall for the percentage, but I think it's good to make sure that we are on the same page with what numbers we're looking at.
Sure. Let me just say that Sarah did mention in a report that the report of the 9 deaths was for a 36-day period of September, October, so it wasn't all of September and October, and that's probably what that's about, Sharon.
Okay.
Having not made the report, I can't say for sure, but part of the reason she does that is to protect the patient's privacy, so that people aren't trying to see who is the person that passed from not being vaccinated. And so the data, I'm confident that the data is accurate in terms of the total numbers, but it's not done month by month. So those deaths in October reflect, I think, all of October, but only part of September.
Okay. And thank you for that clarification. And if it's possible to make a request for the next time, if we can put the dates on the actual PowerPoint. I may have missed it, but I believe I read it as September and October.
Yeah.
And so just to reduce that possible confusion, and if it's my fault for the confusion, then I apologize. The other one is, I'm wondering, there's 2 other questions. One is a data point that we don't have. We talk about the decreasing effects of the vaccine. Is that easy data to look at for people in Lake County who were vaccinated because we know when they got vaccinated. They're in a computer somewhere, and I'm sure we have access to that information to find out once people drop off after the 6 months, how we can correlate that to the unvaccinated and vaccinated percentages of hospitalization to see if there's a correlation there or not, at least the way it's working in our community. I think that's something I have not seen. What's the population vaccination of the last 6 months, and what's happening in our hospitals and our mortality rate when we're always comparing the unvaccinated and vaccinated. Just to kind of have, I think that would be interesting information to look at and might offer a more poignant point of the impacts of the vaccine or the decrease of the impacts of the vaccine based on time passed. And my second one is, there's been a lot of conversation, and I know that even at the state level there's this conversation, and the data might be difficult, but if it's possible in a future agenda when we speak about COVID, to talk about those who have been impacted and had COVID. What is the timeline for the immunity that they had? Are there some who may have zero immunity, some that have 100% immunity? Is it 3 months, 6 months? Is it longer? I know there's some studies out there. There's some still ongoing studies going, but it's difficult to kind of hammer down what that looks like. And I know we're supposed to wait maybe 2 months, I think it is, if I'm correct, before you do get vaccinated if you did have COVID. Just to have that conversation, because we've had a lot of people impacted and getting sick with COVID, and to try to inform them and educate them on what is actually happening with their bodies and what are they dealing with out in the community where COVID still is.
Yeah, I'd be happy to look at that data and present that at the next meeting. Let me just say, I love the way you think about, you think like an epidemiologist in terms of the way our immunity drifts, and if we could look at that specifically. I'm sure that data could be extrapolated because we have the vaccination data, but it would take an epidemiologist to take it and sift it and say, you know, we have this many people whose immunity is beyond that 4-month point where they need to be boosted. And we're not looking at the number of boosted people. You know, we're considering people fully vaccinated if they've had 2 vaccines, or in the case of Johnson & Johnson, 1 vaccine. And that's a much more sophisticated analysis. And I agree, it would be nice to have that. And at the same time, I would say our biggest bang for the buck is still getting those who are unvaccinated vaccinated, because those are the people who are much more likely to be hospitalized and much more likely to die.
Right. And I am not putting a timeline on when I would like to see that data, because I don't know how difficult accessing all that data would be. It was just more of in the future, when possible, when it's all able to be collected, if we can have that conversation. Because I think of things that I don't necessarily know the difficulties of accessing those things or putting it all together. So
I will pick Sarah's brain on that and see what she can come up with.
Perfect. Thank you so much. And we have Supervisor Paiska.
One more question. With the vaccination rate and the vaccinated, the unvaccinated, and then the booster, is there going to be a change in definition on what fully vaccinated means? Is that going to include people that have the booster, or is that going to be a separate category?
So I have not seen any guidance from the state on that. You know, I think right now they are still considering people fully vaccinated if they've had the 2 of the Pfizer and Moderna and 1 of the Johnson & Johnson. I would expect over time they are going to adjust that, but I haven't seen any guidance in that regard.
Okay.
Thank you very much. If there's no further comments or questions from board members, let's go ahead and open it up for the public. Anybody in the board chambers wish to speak on this item? Please come up to the microphone. You have 3 minutes.
I would like to direct my question to the doctor here.
No, you could direct it to the board, and we can ask the doctor to respond if needs be.
Okay. I just would like to ask you, perhaps, if you are aware of the fact that PCR tests have been, by CDC, were declared invalid. because they cannot differentiate between so-called COVID-19 and ordinary common flu. And I want to, get the answer for that. Supposedly it's going to happen at the end of the year, not prior to that. But there is no test I know of which would identify COVID-19 virus. And that never was one. So that's my question. The other item is perhaps the medical errors statistics for the United States. And that would be something I will have to read. But medical errors cause an estimated 250,000 deaths in the United States annually. Okay, those are medical errors. And, it goes on and on and on. We just should start looking to the beginning of this thing. Because for starters, we are under censorship. The media, so-called media, disguise, basically put people who have different understanding, even if they're specialists, like the doctors in Kern County. Initially, they decided that they tested 4,000 people in Kern County. They couldn't find any virus. And that was, of course, on YouTube, and it was taken down within 2 weeks. It's an ongoing pressure against information which varies from what is the official line. And that's the disaster of it, that we don't have a freedom to express various understandings and information which should be available. And it's been going on for 2 years. So, like I said, PCR tests, I don't know of any other tests. The man who developed PCR tests declared, Mullis was his name, that that test cannot be used for identifying any virus. It's not meant for that. He got Nobel Prize for it, but he didn't agree with anybody using his test for identifying viruses. And he incidentally died 3 weeks before, a healthy man, 3 weeks before this whole charade started. So the other interesting thing is 3 countries in the world decided to not allow...
And your 3 minutes are up. If you can just go ahead and provide your last statement.
Excuse me?
Hello, up here. Up here on the board.
Oh, I can't even hear.
Your 3 minutes are up.
Thank you.
And so if you can, okay. And Dr. Evans, I know that we've had this conversation before about the PCR test, if there's anything that you can provide. I know that they are updating the PCR test so that now it can differentiate between COVID, the flu, and cold. But if you can provide more expert
So
comments.
PCR is a technology that's been developed to look at genetic material, and the genetic material of different viruses is different. We use it not only for viruses, we use it for bacteria. This is a technology that's been very, very well developed, is extremely sensitive and extremely specific. It is not invalid, it is not bad data. It clearly detects the COVID virus with great accuracy, greater than 95% accuracy. And probably the inaccuracy is not from the test, but from the swab. If you don't swab properly, then you're not going to get good data. But if you swab properly, it's probably close to 99.99% accurate. And we're really, really lucky to have this technology.
And I do want to add that according to the CDC, there was an almost 18%, I think it was 17.8 or something like that, increase in deaths in the United States in 2020. And so to say that there is no virus, then please explain to us what people are dying from. There's very good, strong medical science for what is happening. Whether you agree with some of the actions that we're taking, I think that those things can be debatable. But the virus itself, it's very difficult when you've lost family and friends, and it's getting closer and closer to family and friends, to still make the statement that it's fake. And your time is up. I'm just responding to your comment, and we did not censure your comment, as you stated is a part of the problem as well. Everybody has their 3 minutes and their ability to come and speak to us in a public meeting.
Mr. Chairman, I did want to make a statement about his comment on medical errors. And, you know, he's right that there are medical errors. Remember that the people who are creating the medical errors are humans. You know, whenever you have humans doing anything, they're going to make mistakes. And we have lots of patterns in place to try to prevent errors, and we're much better than we were 5 years ago or 10 years ago, and we still make errors every day. And I apologize for that, but we're all human, and we'll continue to do the best we can do, but know that none of us are perfect. Very different than talking about a technology that we know has special qualities, and we know we can look at that data and be confident with it.
Thank you for that, Dr. Evans. Any further public comment in the board chambers before we move on to the Zoom room? Please come to the microphone. State your name, and you have 3 minutes.
Joan Moss, I want to know if we, as members of the public, are given accurate information about what is in the vaccines that we are receiving. Thank you.
We have not provided you that information from this board. That information is available through the manufacturer and through the CDC and FDA for all the reviews that have been had in order to get some of the approvals that they've had, whether it's emergency or non-emergency approvals. And Dr. Evans, if you want to add to that.
I would only add that we have experience of millions upon millions upon millions of cases, and that the safety and efficacy of this vaccine is superb. That doesn't mean that it's perfect. It's superb, and it's one of the best vaccines for such a pandemic that we've ever seen. And we're so fortunate to have it in this country and to have ready availability of it. Many countries are still not yet vaccinating their population against this disease, and you know, we're incredibly fortunate to have it.
Thank you. Let's go ahead and move on to the Zoom room. Let's start with Carlos Bono. Again, state your name, and you have 3 minutes. You're still on mute.
Can you hear me? Can you hear me now?
Yeah, we can hear you.
Okay. First, this is Carlos Bono. I'm a resident of Middletown. And I first would like to let the board and other citizens of Lake County know that a new website called standuplakecounty.org has been started. The website represents a grassroots community group of activists working on the county level to protect and restore our rights to medical choice and freedom guaranteed to us in the U.S. Constitution, the Bill of Rights, and the California Constitution. We also emphatically object to the use of medical mandates for citizens to participate equally in society and the economy. A petition with change.org advocating medical rights in Lake County can be found on the website, and we urge concerned citizens to sign it. We also encourage Lake County residents that have suffered a vaccine adverse event to tell us your story on the form at the website. Now I'd like to address the board on the superb, safe, and effective COVID vaccine. First, the VAERS data on the CDC's own website as of November 5th indicates 875,651 reports of adverse COVID vaccine reactions, including 18,461 deaths and 91,982 hospitalizations. The report also shows 29,104 permanently disabled and 20,644 life-threatening side effects from the so-called vaccine. On Friday, a federal judge for the 5th District upheld a ban on Biden's administration's unconstitutional mandate for employers of 100 or more employees being obligated to be vaccinated. Judge Kurt D. Engelhardt wrote, "From economic uncertainty to workplace strife, the mere specter of the mandate has contributed to untold economic upheaval in recent months." Now, this information about the vaccines is to show that they're completely ineffective and dangerous and life-threatening to many people, especially young people that have hardly any risk from COVID. To vaccinate 5 to 11-year-olds is insanity. As we approach the winter months, more people are getting sick because, and these are people that are fully vaccinated, by the way. This is because they're suffering from antibody-dependent enhancement. And it's only going to get worse. And I want to finalize by stating that anyone who's experimental gene therapy shot, especially medical professionals and others in position of authority who knowingly coerce, bribe, or otherwise force people to accept this experimental medical procedure without informed consent will be held liable for crimes against humanity as a consequence of this insanity becomes irrefutable. Thank you.
Thank you very much. We're going to do a quick pause at this moment and continue with public comment very soon. I need to check in with our CAO. Our room is getting a little crowded. We need to get some seats. We need to figure out how to make sure to social distance for you all. I know that there's an important upcoming, who here is for item either 6.3 or 6.4 or 6.5? And
So I'm sure you figured out we've exceeded the.
no, yeah, so I'm trying to see if there's some shuffling that we can do it. It looks like the majority of the crowd is here for 6.6. And so if you can give us about 5 or 10 minutes, we need to figure out how to make sure to adequately make this work so that everybody can participate. We want to hear from everybody. Just do want to remind you that it is possible to join us on the Zoom room where you will not be missed. You will still be able to provide public comment. And so, again, let's go ahead and take a 10-minute break. We'll be back at the earliest at 10:13.
Sam is reversing the TV so people can watch from outside as well, as we have done in the past.
Okay. Carol, do we have more seats that we can put in here? Because I feel like some of these tables with 2 chairs is just...
Capacity for 25, but that doesn't really matter how.
Okay.